Good morning, everyone. Diabetic retinopathy is the leading cause of vision loss in the world today. Numerous choroidal vascular abnormalities have been reported in patients with diabetes mellitus. So today, I, Dr. Sri Lakshmi, am here to present my study on the topic changes in choroidal parameters in patients with type 2 diabetes mellitus. Choroidal vasculature, mainly choriocapillaries, supplies nutrients and oxygens to the outer retinal layer, retinal pigment epithelium, and the photoreceptors in the foveal region, mainly where there is no retinal vasculature. So it states that choroidal blood flow in the foveal region becomes slower in patients with type 2 diabetes mellitus, which can result in choroidal hypoxia, which leads to thinning. In my study, I was aiming to expect the value of mean subfoveal choroidal thickness, mean nasal and temporal parafoveal choroidal thickness, and the mean choroidal vascularity index in patients with diabetic retinopathy and with patients with no diabetic retinopathy, and also how these parameters are affecting according to the severity of the disease. So I did this study as a prospective cross-sectional study in the patients attending ophthalmology OPD and patients with type 2 diabetes mellitus of more than 5 years of duration and between the age group of 35 to 75 years, and 72 eyes of 72 patients were taken into consideration. And eyes with a refractive error of more than or equal to plus or minus 3 diopter, eyes with previous history of retinal surgeries, previous history of lasers, eyes with already existing retinal disorders including retinal vein occlusions, ARMD or glaucoma, these were excluded from the study. And detailed ophthalmological examination were done for every patient, including an extended depth OCT was taken, and patients were grouped according to group 1 with diabetic retinopathy and group 2 without diabetic retinopathy. And again, this group 1 with diabetic retinopathy was divided according to the severity of the disease. And the study parameters were recorded, and from an extended depth OCT, a vertical distance between the hyperreflective Bruch's membrane to the hyperreflective choroidoscleral interface was taken as the subfoveal choroidal thickness, and the same vertical distance was taken at the nasal and temporal gradient with 1.6 millimeter at the foveal center as the parafoveal choroidal thickness. To calculating the choroidal vascularity index, we created a algorithm for image binarization, and from a grayscale OCT image, after image binarization, we got a binarized OCT image, and a 1.5 millimeter segmentation block of the subfoveal choroidal area was selected as the region of interest, and the total subfoveal circumscribed choroidal area was calculated with total number of dark pixels as well as light pixels, and total luminal area was calculated as the total number of dark pixels. Then the ratio between the choroidal luminal area and the total subfoveal choroidal area was calculated as the choroidal vascularity index. And these data were entered, and the statistical analysis was done, and p-value of less than 0.05 was considered as statistically significant. And from the results, 72 eyes of 72 patients, 32 were of females and 40 were of males. 60 out of that were with diabetic retinopathy and 12 without diabetic retinopathy. And after that, the result we got was the subfoveal choroidal thickness, parafoveal choroidal thickness, both nasal and temporal, was significantly reduced in group 1 with diabetic retinopathy when compared with the group 2 without diabetic retinopathy. And the significant difference was also noted, that is, significant reduction was also noted in the choroidal vascularity index with diabetic retinopathy, that is in group 1, when compared with the group 2. So what, according to the severity of the disease, from no diabetic retinopathy to the proliferative diabetic retinopathy, the thickness was decreasing, that is, the significant thinning was noted. And the choroidal vascularity index was also reducing, that is, significant reduction was seen. That all the study parameters were significantly reduced according to the increase in severity of diabetic retinopathy. So, the similar results with subfoveal choroidal thickness thinning was noticed in other studies also, especially the one done by Sudhakar et al. In an Indian population, but contradictory result of thickening was noticed in other study done in Korean population by Kim et al. And the choroidal vascularity index was significantly reducing in other studies also in patients with type 2 diabetes mellitus. So, in conclusion, the choroidal blood flow deficit can be an early pathologic change in diabetes mellitus. So in patients with diabetes mellitus, these alteration in these choroidal parameters may indicate the role of vascular change in choroid in the development and prognosis of diabetic retinopathy. So detection of this thing, that these can be considered as the earliest marker, and so that we can knock out the leadership like the knock out the position of diabetic retinopathy from the leading cause of blindness in the vision loss today. So that's all from my side. Thank you. These are my references.
Very good, but
Yes, sir.
you're told that choroid, that is thinning of the vascularity in the choroid
Yes, sir.
is the most important. It's the earliest finding.
It was, yes, sir.
Suppose clinically I cannot see, that. So only we need a OCT.
Yes, sir, OCT. Clinically, no, sir, by OCT. By OCT.
Suppose OCT you have seen, the same patient had any microaneurysms or not?
Yes, sir. We also did the fundus examination. After that, only we did the OCT.
Then microaneurysm was seen before doing OCT or after only you have found out?
So before doing OCT, first fundus examination was done, and after that, patient was categorized. Then we did an
Okay,
OCT.
then, which is the earliest finding then?
So actually,
How can
my
you say that choroidal vascularity is the earliest finding problems? You mentioned that earliest
Yes.
finding. But you told microaneurysm was present before itself.
Sir, my purpose of my study was in a country like India with so much population, around 1.4 billion population. So only few ophthalmologists are here. So these are OCT and other things are made for an artificial intelligence or a machine-related thing. So we can't go and diagnose these things in every patient. So if we create a universal user interface, so that we can take things like this, and so I think that.
Then you can advise OCT for all the diabetic patients, enter your OP. Is it possible?
Actually, for
Because you told
cost-related thing,
earliest finding,
yes, sir.
earliest sign is choroidal vascular
Vascular
problems.
thing, yes, sir.
So if you start doing from the beginning, why can't you find out early so that you can control diabetes and all? No? At least
It's possible, sir. It's possible. We can go for that. Maybe after a few times, may the cost reduction is there, we can advise it for every patient because there is no other risk
See,
factor
the
in doing.
microaneurysm,
Yes, sir.
if it is very small, so you cannot detect. At least you need some size of 20 microns.
Yes, sir.
So that suppose what you have seen microaneurysm, maybe more than 20 microns.
Yes, sir.
If it is less than that, you may not find.
So finding microaneurysm depends on the doctor who examined the fundus. So if someone is not able to pick something, otherwise the machine can pick it up. So this is a one-click result. So these things are to be considered in this era.
Did you find any confounders that affect the choroidal thickness in these patients?
Ma'am, actually, even hypertension.
Yeah, all these can affect.
Yes, ma'am.
So that was excluded or?
Hypertension was not
into?
excluded, ma'am. It was not excluded.